It's a great pleasure to be with you, and it's also a fantastic opportunity to celebrate this 25th anniversary of the launch of the fexofenadine. I would like to thank Sanofi for inviting me to this symposium, and I will talk about the keeping allergic rhinitis and urticaria sufferers living their bleedness and the integrated management. This is my disclosure. We know that the prevalence of allergic rhinitis continues to rise in the 21st century, and the prevalence range from different studies from 1% to 63%, according with the different regions of the world. But the overall median prevalence of unspecified rhinitis is around 30%, allergic rhinitis 18.1%, and non-allergic rhinitis 12%. But of course, also they vary according with the different geographical regions. Well, we also know that in all the allergic disease, but also the allergic rhinitis, the prevalence continues to rise. And probably the major causes of this increment are due to the environmental changes, the climate change. Also, we know more about the hygiene hypothesis and the effect of the air pollution in all the cities. And also to take into account that allergic rhinitis is very often associated with comorbidities. Well, we know that most of the allergic conditions, like the allergic rhinitis, start in childhood and peak during the highly productive years of the individuals. And probably these numbers are underestimated because many patients, they don't know that they are suffering allergic rhinitis, but even sometimes some doctors are not able to recognize properly the allergic rhinitis in the patients. It is estimated that approximately 45% of patients have never received a diagnosis of allergic rhinitis. And also we know that these allergies affects the personal development, the career plans, the lifestyle choice, affects the sleep, the mood, the school and work competence, also the social interactions. And also we know that allergic patients usually have high risk of developing depression. Probably the impact of allergies on quality of life can be as high or even higher than that disease commonly perceived as being more serious, but allergies is not a trivial disease. Also, we know that in the case of allergic rhinitis, in this study of Roberta, we can see that 24% of the patients will suffer the allergic rhinitis for the whole life, and more than 50% will suffer for more than 10 years. So it's really important to have a very good treatment for just control these symptoms of allergic rhinitis. And in fact, also affects the childhood. And this is a study carried out by Susan Walker in United Kingdom, where the students are compared during the winter exams when there is no pollen in the air, and the summer exams in June, when it's also the high peak seasons for some pollen. Well, it's very easy to see that 36% of the patients that are doing very well the exams during the winter, they fail at least one grade, at least one subject in the pollen season. And this is even more dramatic if the patients are taking first-generation antihistamines. In allergy, we would like to say in the World Allergy Organization, we like to say that there is not a single reason today to use first-generation antihistamines. And also we know that the allergic rhinitis is with comorbidities affecting and inducing conjunctivitis, severe asthma, atopic dermatitis, chronic rhinosinusitis, otitis media, upper respiratory tract infection, and at the end it will create emotional disorders, sleep disturbance, inattention and reduced short-term memory, familiar, social, and behavioral problems, mouth breathing, and in fact, we have a decrement of the quality of life. And what the patients have as a choice for the treatment? Well, what the patients prefer always is the first is to take just a simple tablet, an oral antihistamine, followed by the intranasal corticosteroids. And unfortunately, also the patients likes to take a lot of decongestants, but we know that the use is limited and it has to be just used for less than a week. And then we have all the other treatments. So it's clear that the preference of the patients is to take a small and the tablet of antihistamine together with intranasal corticosteroids. And how is the optimal treatment or the optimal management for allergic rhinitis? We have this slide that is from an article of Professor Glenis Skadi, where you can see that the first choice is always the antihistamine, oral or nasal. And if it is not enough to control the symptoms, we will add nasal corticosteroids. And if it's not able to control all the symptoms, then we have other treatments. So we have this kind of a step-up therapy if the symptoms are getting worse, and also a step down when the symptoms are improving. Of course, always avoiding the triggers, and have also some saline dosing, and when it's indicated, the specific immunotherapy. But what is ARIA? ARIA was so important because they actually bring new classifications. So the new classification that it was if the symptoms are intermittent or if the symptoms are persistent, and also according with the severity, mild or moderate severe, and which are the different choices. So we established this scale that is just starting from the antihistamine, adding all the other choices. But what is also very important in ARIA was this integrated care pathway, that patients that suffer from allergic rhinitis, we have to check if the patient is suffering also asthma. So when we have the rhinitis that is assessed by the control by visual analog scales, we have to check and if there is asthma, also to provide appropriate treatment for the asthma. If the asthma is not well defined, then we have to do these questions for asthma. Have you had an attack or recurrent attacks of wheezing? Have you had a troublesome cough, especially at night? Do you have cough or wheeze after exercise? Do your chest feel tight? So this question may help us just to determine if the patient that arrives to our clinic just suffering from allergic rhinitis, also to know if they are suffering asthma. But on the contrary, we may have patients that are suffering from asthma, and in this case, we also need to check if the patient is suffering or assess if he's suffering allergic rhinitis. And again, we have different questions like the ARIA questionnaire to know if they are suffering allergic rhinitis, if they have for more than 1 hour most of the days watery rhinorrhea, nasal obstruction, nasal pruritus, conjunctivitis. And also, we have also some information regarding what is not usually an allergic rhinitis, like unilateral symptoms, mucopurulent rhinorrhea, nasal drip, pain, recurrent epistaxis, or anosmia. These are the really major goals of ARIA, so that we have always to treat our patients, the upper and the lower airway together. And in this case, also, how should be the integrated treatment? Well, we know that many patients take the drugs by themselves, so it's self-care, and they just go and speak with the pharmacy, with the pharmacist, just to try to find a solution. So it's also important to educate, and that's why it was created ARIA in the pharmacy. But also, then the patients that are not enough improving go to the general practitioner, primary care, but primary care and specialists, we need to talk the same language. That's why we have the next generation ARIA World Allergy Organization guidelines. So we are just trying to put the same levels of knowledge in order to give an appropriate treatment to our patients. And this is the way that we have to integrate all our patients from the beginning to the most advanced specialized medicine. But what is the problem with the antihistamine? Well, many people take half, we could say, that takes the antihistamines continuously, and the other half take on demand. Well, and what is the importance of taking on demand or taking just continuously? Well, we need to know this concept, that is the minimal persistent inflammation in allergic rhinitis. What it does mean? It means that we may have symptoms, of course, and we have inflammation, but we sometimes have inflammation without symptoms. This inflammation has to be also treated. I mean, it's very important that we also provide treatment at this level, not only when the patient is suffering symptoms. And that is why in this article review by Lekman, it was said that the support that continuous use of antihistamine is being more effective than on-demand therapy. And the reason is that we know that antihistamines, the second generation antihistamines, also have anti-inflammatory effects. But in order to have this anti-inflammatory effect, that of course is less than the anti-inflammatory effect that is made by intranasal corticosteroids, but also the antihistamines, they have this quality, but we need to give the antihistamine in a long term continuously. So it's very important to give the treatment continuously. And what is the role of fexofenadine for these allergic sufferers, mainly in quality of life? Well, these studies clearly were almost 700 patients, sufferers of seasonal allergic rhinitis, received fexofenadine 120 milligrams or loratadine 10 milligrams as comparator and placebo. Well, it's clear, and you can see here that regarding the activity limitation, the practical symptoms, the emotional function, and the overall score of the quality of life, you can see that fexofenadine is superior to loratadine in improving the quality of life in every single domains of the quality of life. So this is very important because we have a drug that is really effective in our patients. And this was not always observed only when we compare loratadine with the placebo. And another important thing is how, regarding the quality of life, how fexofenadine significantly reduced the work and activity impairment. And in this case, it was 845 patients with a seasonal rhinitis that received 2 doses of fexofenadine to compare 120 and 180 compared with placebo. And you can see that in the work impairment, in the activity impairment, and in the classroom impairment, there is a more effective effect of 180, but also 120 is clearly significantly more effective than placebo. So both doses are showing the good effect in just reducing the impairment of the work activity. And another important concept, we know, and we just mentioned in the first slide, that our allergic rhinitis is conditioned and is aggravated by air pollutants. But so it was necessary to do a proper study. So in a chamber in Canada, at the Queen's University, it was carried out this study where first there were 3 phases. In the first phases, the patients were they were allergic to ragweed, they were just exposed, and the symptoms were controlled. After 14 days, the same people were exposed to the ragweed plus diesel exhaust particles. And 2 weeks later, again, the same patients were divided in 2 groups. Half were receiving fexofenadine, half were receiving placebo, and they were again exposed to the ragweed plus the diesel exhaust particles. What is the important results of this study? First of all, is that it was the first clear demonstration in a chamber that air pollutants can significantly exacerbate the seasonal allergic rhinitis symptoms. So it's the first demonstration clearly in the chamber. And also, it was the first time that an antihistamine shows that significantly alleviate the pollutant aggravate symptoms. So this study was very, very important because every single individual symptom were improved in this study. So it's a really recent study because it's just a couple of years ago. And also, we are able to see how fexofenadine improve the symptom of the seasonal allergic rhinitis in children. And when compared with placebo, we have 935 children, and you can see how every single symptom, the sneezing, the rhinorrhea, the itchy nose, mouth, throat, and eyes, the itchiness, watery eyes, and the nasal congestion, in all the single symptom, fexofenadine was superior and was improved really much more than placebo, the symptoms of our patients. So, how many studies we have for fexofenadine? Now that we are celebrating the 25 is good because also we have a lot of studies about fexofenadine. Actually, we have 2,152 records identified, 120 records were assessed, 20 relevant, and 8 double-blind placebo-controlled were analyzed by Enrico Compalati and the team. And actually, it was clear the message. And regarding the efficacy, a significant beneficial effect on total nasal symptom scores and nasal individual symptoms was seen when fexofenadine was used versus placebo. And regarding the safety, that is probably one of the best things also of the drug, is that there is no significant difference between the fexofenadine and the placebo. So it's really a drug that is very efficacious and also is very safe. And what is regarding the results of the different studies that were considered in this meta-analysis? So you can see that in all the studies that from Paul Wackenberg, Peter Howard, Tom Casale, and all the others, etc., in all of them, you can see that the fexofenadine really has a significant beneficial effect regarding all the symptoms like we mentioned: sneezing, nasal itchiness, nasal congestion, and rhinorrhea. So, but there is not only antihistamines important for allergic rhinitis, also is the drug that is for election of urticaria. And this is also very important to use second-generation non-sedative antihistamines. And you can see that the chronic urticaria is also increasing in male and female, and of course in total around the years in the world. And this tendency continues to increase. And also we know that the urticaria really, half of the patients complain about the effect in the daily functioning, but also in emotions. So we know that regarding the functioning, of course, they have, because the chronic urticaria disrupts the daily life, the sleep, the work, the school, but also makes that the patients with urticaria feels annoyed, frustrated, embarrassed, angry, anxious, depressed, etc. So it's really not only affected the functioning, but also the emotions. For us, for doctors, we always think in urticaria, we think in the mechanisms and these things, but for the patient, this is not important. For the patient, it's really important how they feel, how are the symptoms, and how they feel regarding, as we mentioned, the functions and emotions. But that's why it was the classification reviewed, and the urticaria was divided according with the duration. When it's less than 6 weeks is acute, and when it's longer than 6 weeks is chronic. And we know that the chronic may be spontaneous when we have not obvious specific trigger, or inducible. Inducible where the different conditions, temperature, pressing, cholinergic, etc. And in the spontaneous, we know some known causes that maybe are behind, like to have an infection or to have an autoimmune disease. And also, sometimes we don't know the causes. The important thing, and you can see here in red these dots, for all kind treatment, for all kind of urticaria, the first line treatment is non-sedating H1 antihistamine. Because we know that the itchiness and physical discomfort are not well treated in 68% of the patients with suffering chronic urticaria, and the sleep disturbance caused by chronic urticaria are also not well treated in half of the patients. So what the guidelines say? Well, as we mentioned before, in the previous EACI Galen EDF WOW guideline, the definition, classification, and diagnosis and management of urticaria, you can see that in all kind of urticarias, the first line treatment is non-sedative anti-H1 antihistamine. But what happens nowadays with the coronavirus that induce urticaria? Also here we have to use the second generation antihistamines. Also for that urticaria, it's important to use the antihistamines, non-sedative anti-H1. And what we did in the World Allergy Organization a long time ago, we did also great, and we saw that for all kind of urticaria, we have a quality of evidence that is high, and the recommendation is strong to use non-sedative H1 antihistamines. So the modern second generation antihistamines are those that are indicated in this disease. That's why also we reviewed this recently, and is one of the last articles of our friend Mario Sanchez Borges, that we were just reviewing all the facts of the chronic urticaria, the epidemiology, the immunopathogenesis, the comorbidities, the quality of life, the management, and in the second part, the treatment, how to treat properly the chronic urticaria. But specifically, we just did this recent article just to check how was the fexofenadine playing a role in this urticaria in pediatric and in adult population. And we saw actually, and include these studies, that we see that the fexofenadine once a day significantly reduced the pruritus and the wheals in the chronic induced urticaria. And actually, you can see here how is the change from the baseline, mainly the itchiness scores, and also regarding the wheel score. So when we just wish to see how is the effectiveness of the fexofenadine, you can see here that is so clear the evidence that is really working and is efficient reducing the pruritus and wheals in the chronic urticaria. There are so many studies that will just demonstrate the effect of the fexofenadine in pediatric and adult population. This is also from our article, but we can conclude that the aim of the treatment for urticaria is that full control of the associated wheals and pruritus, And fexofenadine has been shown to significantly reduce the symptoms with being well tolerated. Also, there is efficacy together with good, excellent safety. So what is an ideal anti-H1 antihistamine? Well, it's the one that is well tolerated, that is quick, and is easy to use, and also it will be just working for the whole day with a single doses. This is the what we expect. So what we can conclude today? Well, second generation H1 antihistamines are the first line treatment for allergic rhinitis, allergic rhinoconjunctivitis, and urticaria, all forms of urticaria. The non-sedating second generation antihistamine fexofenadine showed high efficacy and safety profile in the allergic rhinitis and urticaria control, improving the quality of life. And also that continued use of antihistamines has been more effective than on-demand therapy to reduce the allergic inflammation.